Once you have eradicated SIBO, how do you prevent it from coming back? You talked a little bit about prokinetics. You could expand on that, and what else would you do to prevent SIBO from coming back?
Yeah, so the prokinetic, I'd say, is probably the most important factor. There are a few prokinetics that we can use. There's one that I've been finding is extremely effective. It's a prescription motility agent. It's called prucalopride. And again, there's sometimes some obstacles as far as insurance coverage. So we try to get around that with prior authorization or however we can do that. Again, we can also source from a Canadian pharmacy or internationally if we need to. But that is one of my favorite motility agents in its effectiveness. It also has some studies that it can help heal the MMC, which is a huge plus.
Yeah.
So if I can get a patient on that and they tolerate it well, that's probably my number one. But there are other effective good agents out there. There's an over-the-counter product. It's called Iberogast. It's an herbal product. It works quite well. There's erythromycin. It's an antibiotic, but in low doses, it actually has a really nice side effect profile and it works well. There's also naltrexone in low doses. So low dose naltrexone can work as a motility agent. So I either have a patient on one that I think is working really well, or even a combination of these can be helpful. So prokinetics definitely need to be on board. Again, the meal spacing, like I mentioned, and just teaching patients that lifestyle has a lot to do with helping, avoiding the relapse. So making sure that the diet is really clean and that they're getting enough sleep and that they're hydrating well and they're managing stress. Stress, we all know stress has a huge impact on digestion. And so that is usually a factor that I at least mention, and it's more of an issue with some patients, than others. Sometimes making sure that hydrochloric acid is replete. HCl is produced in the stomach and it prevents bacteria from getting through to the small intestine or like from an oral route. Yeah. We want to make sure that that's replete. And again, just dealing with any of the root causes that led to the SIBO in the first place.
Yeah, exactly. So what are the most common underlying causes of SIBO that you see?
Causes of SIBO. So yeah, I mean, it's sometimes hard to know exactly what the root cause is. But in the studies, it shows that the number one cause for SIBO is food poisoning, some prior gastroenteritis caused by a microbe. And the reason for that is when the patient had the food poisoning, their immune system had this major response and created antibodies, and that inflammatory response damaged the MMC. So, of course, again, with a damaged MMC, someone becomes more susceptible to the overgrowth of bacteria in that small intestine. And again, I mean, it's important to note, it's not the bacteria that caused the food poisoning in the first place that has overgrown. So that's been dealt with by the immune system. But it's that damage to the MMC having been caused by that then allows for the normal bacterial flora to either come up from the colon and not get swept out, or come in orally and not get swept out.
So there's a test for that, right? That Dr. Pimentel come up with, the IBS Smart.
Yeah, there is, and it's an exciting development because IBS again has always been this sort of clinical diagnosis, and now we have a test that is developed specifically to diagnose it. And it's exciting. And basically what it's looking for are those antibodies that I mentioned that are reaction to that food poisoning microbe. And so if it's positive, then that's positive for IBS, and then gastroenterologists wouldn't have to look elsewhere for the explanation of someone's digestive symptoms. And then again, if that test is positive, because 86% of IBS cases are caused by SIBO, that would certainly flag a huge suspicion for SIBO and would make me want to do the breath test as well.
Exactly.